I'm Dr. Taha Shipchandler with IU Health Physicians. I practice facial plastic surgery and otolaryngology, and I've been in practice since 2010. I became a doctor because I wanted to improve people's quality of life. Specifically, there's a story behind this in that when I was in college, what happened is that a patient came up to me when I was shadowing a doctor in a hospital, and I saw this patient who had just had a bad motorcycle accident. Their face was very deformed and mangled and had a lot of different scars, and so they had to undergo a huge reconstruction. I saw the reconstruction about midway through, and since then I looked at that patient, I realized, gosh, like everyone in this room and in this office is really kind of staring at that patient. This is the kind of thing that, knowing that their face is really their way of interacting with the world, I'd really like to make that better. And honestly, that's what brought me into facial plastic surgery. Your face is the first thing you see in the morning and the last thing you see at night before you go to sleep. Therefore, what I love about my job is being able to work on people's faces. Your face is your way of interacting with the world. And I pursued otolaryngology first because I realized the senses of the head and neck are your ways of interacting with everyone else. Specifically in facial plastic surgery, it's your face that uses, whether it be facial expression, whether it be smiling, whether it be the subtle raise of an eyebrow. All of these things are the way we interact with people on a daily basis. Ultimately, I saw patients over and over again that weren't able to do some of those things. They weren't able to, say, move their face on one side of on one entire side, or they weren't able to raise their eyebrows or close their eyelids, and I realized this is a devastating condition. These people shied away from the camera, shied away from photographs, were clinically depressed, and therefore ultimately I decided that's what I love the most is facial plastic surgery. Being able to make someone look quote unquote normal after a severe injury, whether it be a trauma, congenital injury, a tumor, or anything else that may cause that. When patients come to see us in the office, first they meet my nursing staff. We like to think we're a bit of a well-oiled machine. We walk you through a process, you take a few questionnaires, therefore we can conduct research long-term based on your anonymous answers, and ultimately I meet you and we discuss what's most concerning to you. Is it that you just can't breathe through your nose very well, or you had an injury at some point in time, or is it rather that there's something about your face that particularly you don't like that you find asymmetric, or your daughter had a bad dog bite injury and you just want more information on that, or you suffered a facial fracture in the past, or you have a facial paralysis. There's a variety of things that you can see from me. What I'll do is I'll do an in-depth facial analysis. We'll often take the time to take photographs in multiple views of your face, head, and neck, and we'll review those together on the computer screen so that you get a real idea of what we're really talking about and how it affects you and how it may affect everyone else. So it's really a smooth process by which you'll meet kind of everyone along the line. Ultimately, from the time point, if we decide ultimately to go to surgery, then you'll meet my surgery scheduler all the same day. So it works very nicely, and we're very proud of that, and hopefully you will be too. Believe it or not, I'm not always in surgery. In my free time, my first choice is spending time with my wife and my 2 kids. I have a son and a daughter. We're Indiana natives originally from Fort Wayne, and therefore we have a lot of friends and family around the area. In addition, we did spend time out of state for many years in training, both in Cleveland and Baltimore, but ultimately had to get back to Indiana. Here in Indiana, we enjoy very active lifestyles, whether it be playing soccer, rock climbing, playing tennis, swimming, and I even get dragged out on the additional long run with my wife that I cringe my way through.